Hello, my name is Lindbloom, and this is Trista, and this is Butters. And today we're going to be taking his vital signs to check the overall health of your horse. The reason you would take your horse's vital signs are if he's showing signs of colic or signs of distress, or just to know the normal average range of your horse. That way you can relay it to your vet in the case of an emergency. So to start off with, I'm going to kind of walk through our process. Trista's my handler. It's the safest way to take your horse's vitals if you have a handler. And you always want your handler on the same side of the horse as you are. So if I were to step to his other side, I would ask Trista to move to the other side with me. So we have some tools that we're going to need to take his vitals. To start off with, I have my wristwatch that has a stopwatch setting on it. I have a stethoscope to take his heart rate. I have a digital thermometer with some Vaseline to lubricate it, and rubbing alcohol to clean it afterwards. So to start off with, we're going to start with the front and move back to the tail. To start up front, I'm going to step around Trista, and we're going to check his gums, which will tell us a rate of hydration called capillary refill time, and his mucous membranes. So to check first, you're going to check his mucous membranes, and that's right up here on his gums. And you want them to be a nice, healthy pink color. If they're red or pretty much any color other than a nice, healthy, pink, moist color, if they're really pale, he's dehydrated. If they're really red, he's overheated. So to check his capillary refill time on his gums, you're going to want to lift his lip, push in on his gum right here, till it blanches out white, and let go. And you watch it, and you want it to go back to that nice, healthy pink color within 1 to 2 seconds. You can also check his capillary refill time or his mucous membranes. Mucous membranes on the conjunctiva of his eye, but since he really doesn't want me around his eye, we're not going to make him do that today. Moving a little further back, you're going to do a skin pinch test. Skin pinch also checks for dehydration, and you're going to get a little bit of skin right here, and you're going to pinch it until it tenses up, and then you let go. And you want it to snap back within 1 to 2 seconds. If they're an older horse, it's normal for their skin to have lost some of the elasticity in it, so you expect it to take just a little bit longer on an older horse. After you've checked the capillary refill and the mucous membranes and the skin pinch, you're going to move on to his pulse rate. You can check pulse rate in 3 places. Easiest that I find is right under the jaw, but you can also check down low on their leg, just below their knee, and down even lower where you can feel for a digital pulse. The digital pulse is going to be really faint unless you find out that it's bounding, and then you have a bigger problem with heat in their feet. But like I said, I find it much easier to find it under their jaw with this big jugular vein. So you're going to take 2 fingers, and you're going to find that big vein, and you're going to depress it. And this is where your wristwatch comes in handy. And you're going to find that pulse, and you're going to time for 15 seconds. So I got 10 beats in 15 seconds, so you're going to multiply that by 4, and you're going to get 40 beats per minute, which is within the normal range of 32 to 44 beats per minute. So that's totally normal. The next thing that you're going to check is his actual heart rate, which is where you're going to use your stethoscope. You're going to put the stethoscope in your ears, and you're going to feel just behind his elbow on his chest, and you're going to find that heart rate. And you're going to time that for 15 seconds also, and it should be the same. So I got 10 there also, which is within the normal range. It's 40 and 32 to 44 beats per minute. So that's great. He's totally normal so far. Moving on, we're going to check his gut sounds. Gut sounds you're going to check in the upper quadrant and in the lower quadrant. You also need to be really aware of where your horse's feet are and if they're okay with you being high and low on both sides of their belly. You want to be sure that what's normal for your horse, that way you can tell when they're being abnormal. If they're rushing or bubbly sounds or just uncomfortable, you want to know that it's what is completely normal. So you're going to press your ear high. And just listen really closely. And then you're going to press your ear really low. And then you're going to move around to the other side, and I'm going to ask my handler to step to the other side with me. Always let your horse know what you're planning on doing. Listen high. And then listen low. So to me, his gut sounds sound perfectly normal. There's no bubbling, there's no rushing, but they're still there. If they were absent, then we would have cause for concern. So to take your horse's respiration rate, there's two places you can take it. You can take it here at their nostril or at their flank. Taking it at their nostril can be kind of misleading because they get distracted by other smells or things that cause their nostrils to flare. So that count can be misleading. So the way to do it best is to stand right here at their shoulder and watch their flank as it rises and falls with each breath they take. And you're going to count how many breaths they take in 30 seconds. So you're going to use your stopwatch. And you're going to watch their flank for 30 seconds. So in 30 seconds, he took 5 breaths and he snorted once, so that doesn't really count. So 5 times 2 is 10, which falls within the normal range of 8 to 16 breaths per minute. So he's completely normal. Next, I'm going to ask Tristan to move Butters forward just a little bit, and we're going to take his temperature. So using your digital thermometer, you're going to get it out of its little case. And you're going to lubricate it with a little bit of Vaseline or petroleum jelly. I have some petroleum jelly here. You're going to get a little bit on your piece of gauze here. You're going to lubricate your thermometer with it. You want a lot on there. You don't want to uncomfortable. You're going to let him know what you're planning on doing. And you're going to stand to the side of them. You don't want to stand directly behind them. You're going to move his tail. Really let him know what you're planning on doing. And put your thermometer in and press the button. And wait until it beeps. So his temperature is 98.9, which is a little low to be within the normal range. It should be within 99 to 101. 99 to 101, which is completely normal. And so we've come to the conclusion that Butters has completely normal vital signs and is healthy.